Hello guys, this is Dr. Dheeraj Masapu, and in this video I'm going to tell you a problem that general medicine has. This question is asked to me by one of the subscriber. I'll read out the question. Good evening, sir. I have a question regarding general medicine. The PG college where I'm joining for MD General Medicine has excellent case exposure, and we can take independent decisions. Superb. And it has a super specialty posting also, but the major drawback is its ICU is run by anesthesia residents, and general medicine residents don't get a chance to put central line HD catheters, and hands-on is less. I would want to pursue DM in neuro, cardiac, nephro. So lack of skills to put central line, intubation, HD catheter, ICU practical skills, would they matter once I finish my DM in these particular specialities? I'm quite confused, and how should I actually learn these skills after my MD? Is it better to join a college where I can learn all these things before doing the DM? This is a question one of my subscriber asked me. I felt it's very relevant, and I would like to answer this particular question. Okay, so so basically here what I'm trying to tell you is, does lack of ICU skills going to hinder your practice once you become a DM in nephrologist or gastroenterologist or a cardiologist, is what your question is. So I would like to answer that in a very, 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 very simple way. So basically, when you become a neurologist, your focus or the expectation of the hospital which is hiring you would be that you'd be managing stroke. Okay, if you learn stroke intervention, that you will be valued more. You have to focus on that than putting central lines and intubations. And epilepsy, how you manage neurodegenerative disorders, deep brain stimulation, how you convert the patients to deep brain stimulations, thrombolysis, EEG interpretations, neuro intensive care rounds, and then you can guide the anesthesiologist managing, like neurointensivists are there exclusive for that. You can tell them what all to be done, and you will be the person who will be admitting the patient, and under your advisors, they would be managing the patient. So that is the level in which you need to operate. Okay, and you really don't have to sit there and do these central lines and do the intubations and all that, because since there are exclusive people for that, I think you have to focus something like, or you're a cardiologist, then you have to focus more on your angioplasties. You have to learn angiography, and then if you want to go into electrophysiology after cardiology, you have to learn that skill. So you have to focus more on those. Even those are all these are hands-on skills only. You have to learn that, and the expectation from the hospital is that you would be knowing these things. Okay, than intubation and central line and all those HD catheters and all that. If you're a nephrologist, yes, you have to learn, and as part, all the nephrologists would be putting dialysis catheters as part of their training. There is no doubt in that, and that is expected from you. Okay, if you're a nephrologist, you wouldn't call some anesthesiologist to put a HD catheter. You yourself would be doing that. Okay, so then if you're really bothered about learning the ICU, then you can enroll for a 1-year IDCCM program, if some people would be thinking that I'll become a neurologist and then I will have my own neuro ICU in a tier 2 or tier 3 city. Totally acceptable. And then for those kind of people, I would recommend after MD you do IDCCM for 1 year and then go for DM. That method also would help you in a longer run if you're planning to go to tier 2 and 3. But in tier 1, nobody will expect ICU management from a neurologist. Okay, for that exclusive people would be there. And next, you need to understand that if you want to settle in, if you want to really learn all this critical care and all that, it wouldn't be possible because there are DM seats now. Okay, when DNB, DRNB seats are there in critical care, FNBs are there, IDCCM. So those students would be there, and they would be actually interested in learning all these procedures because that is the main thing that they have to learn. So they wouldn't allow you to actually learn in your hospital. And so I recommend you not to focus on these things. Leave that to the experts, and then you focus more on developing more verticals, like in those areas. So the future demand per se, see, if you are talking about gastroenterology, endocrinology, rheumatology, much more demand is there, okay, than intensivists. So what I really feel is intensive care and anesthesia all are dependent branches. So some of you might feel bad. I'm not trying to criticize the specialty. What I'm trying to tell is as a DM in gastroenterology, endocrinology, rheumatology, you'll have much more scope to become a revenue generator for the hospital if you are very passionate in that subject, and then you would actually go to much higher levels, I feel. So you focus more on your core clinical expertise than learning some other things. Okay, so the final word would be don't dilute the work, focus. So in most of my videos, I will tell you, you have to focus on your work, don't dilute it, and you build expertise in your chosen DM specialty, and ultimately you have to focus on that, and then you will be recognized faster, and then you can achieve your financial goals and your goals of becoming a head of a particular center or that easily. Okay, in this healthcare setups that are going to come up. Okay, so I told in my previous videos also that in the next 10 years Indian healthcare is going to expand. A lot of corporates and private equity investors are coming to India, so I recommend you guys to brand yourself and work on niche areas so that people will recognize you easier through social media or Google. Okay, that is the best way to actually build your brand for future rather than learning everything. So leave the intensive care to experts, the DM guys, the DRNB guys, they will manage. You guys focus on your job. Thank you very much for following the video till now. I think it makes sense to most of you, and then I want all of you guys to achieve significant career success in your life. Thank you very much, and good luck for all the guys who are taking different specialties in this counseling. Thank you.